Well, I just want to say that he sounds like an absolute monster. And in my view, he should be put into prison for what he did to you. And because he's never going to have the spine to say it, I want you to know that I am so sorry for what happened to you. That is horrific. This should happen to no one, especially when you're entrusting your life to people that are supposed to be professionals.
Yeah.
Realizing that you were used like you were a science project to somebody.
Hello everyone, if you are a new viewer, welcome. If you're a returning viewer, welcome back. If this is your second, third, fourth time watching one of my videos and you are not yet subscribed, we already go together, okay? Make it official and hit that subscribe button. Today I'm going to be reacting to an interview that Candace Owens did with a trans woman by the name of Briana Ivy. Briana Ivy is a biological male who began hormone blockers at age 14 years old and began having feminization surgery at age 18. And at the age of 20 years old, Briana had bottom surgery, which is surgery where male genitalia is surgically removed and it is sometimes used to create a neo-vagina. In the interview, Briana speaks very candidly about dealing with internalized homophobia, depression, and the negative ramifications of transitioning at such a young age.
You know, it's really interesting because now that this LGBTQIA, the conversation has gotten so big in the country, I go back to my own childhood and I think, do I remember any boys that were more feminine? And the answer is absolutely. I remember particularly one boy who was always playing with the dolls, never cared to play with the girls, never cared to play with the boys at all. He was always with us. And today, that individual is a married gay man. Mm-hmm. So what do you think in your mind made you think, maybe I'm not just gay, but maybe I'm trans? When did you first have that sort of a thought?
I was 12. It was between 12 and 13. And I didn't really know, because a lot of people just called me gay throughout school. So it just kind of made sense. And so I did go along with that. But I had no idea even what being transgender was, what a trans person was, until I saw it online and I saw it on TV. And when I was 12, 13 years old, that was when the TLC show wasn't out. But Jazz Jennings was doing interviews and her family was doing interviews. The show hadn't premiered until a few years later, but there were a lot of interviews online and it was a story that was picking up at the time. And I also was exposed to a lot of transgender people online.
So what you're talking about is culture, yes. And culture matters.
Culture matters a lot. What young people consume through media has an impact on their thoughts and behaviors. And I will give you an example from my own personal life. So I grew up in the suburbs. The area that I lived in had middle class and upper middle class families. And at the time, the town was predominantly white, although there was still a decent amount of ethnic diversity. But despite the fact that the kids from my school did not live in the hood, many of them acted like it.
Gangsters, what's up, guys?
Their parents could afford to buy them whatever they wanted, yet these kids were robbing each other. They were skipping school to smoke weed, wearing their pants under their ass, and this was in the suburbs. I didn't live in the hood.
I'm not a ghetto bitch.
I didn't live in the ghetto, but they learned this behavior not from their environment, but from culture. So it's not hard to see how children can be influenced by TikTok, TV, or their peer group to believe that they are trans, especially when you consider how with each generation, the number of people who identify as LGBTQ doubles.
Broken down over time, the LGBT population of America seems to be roughly doubling every generation. According to a recent Gallup poll, less than 1% of Americans born before 1946, that's Joe Biden's generation, identify that way. 2.6% of boomers do, 4.2% of Gen X, 10.5% of millennials, and 20.8% of Gen Z. Which means if we follow this trajectory, we will all be gay in 2054.
The reason why I'm prodding that is because a lot of times when we dialogue with people who consider themselves detransitioners, which I want to be very clear to my audience, you are not a detransitioner. But when you speak to a lot of people in that community, you'll hear stories of something that happened to them when they were a child. And you see this all, by the way, all across the board on TLC. If you've ever watched my 500-pound life.
Yes.
And once they get into their stories, there's always this thing where, well, when I was 4, I was molested or I had a bad relationship and I wanted to get rid of my identity. I wanted to just be somebody else. And you're saying this didn't happen to you. This was just, you felt like, I know I don't fit in with the guys.
Mm-hmm.
Nothing happened in your background that could have made you feel like you didn't like who you were.
There were a few things. I had so much shame throughout my entire childhood and even up till now recently. That's been the biggest theme that I've lived with.
Shame.
Yeah. I remember being in school and I had safety with the girls, but with other boys, I wasn't. They would taunt me. They were cruel. I had instances where they would touch me inappropriately, and I didn't know how to speak to anybody about that. There was just a culture there where being feminine as a boy was very wrong, and none of the other boys liked it. Luckily, the girls were always like a safe place for me. I remember distaste from the community around me. I remember, and I truly don't believe he meant it intentionally, but I do remember being little, and I did hear my biological father make comments a couple times about gay people.
Mm-hmm.
I remember it, and it stuck with me, even though I was so young, and I don't think that he meant it to like antagonize me, but I still have that memory today. I remember feeling disgusted by the thought of me growing up as a feminine man. I could not envision myself as an adult gay male. Like, it just felt gross to me. And I just didn't like anything really about me.
I have to say that I just find it very ironic that people who emphatically support the trans movement don't see the ways in which it perpetuates homophobia. A young boy likes to play with Barbies, and rather than acknowledging that perhaps he's gay, teachers, parents, and doctors will say that that's a sign that he's born in the wrong body. Back in the day, conversion therapy was seen as homophobic, and rightfully so, but in a way, isn't transitioning gay children just another form of conversion therapy? Now, this gay boy can pass as a heterosexual girl while simultaneously becoming a medical patient for life. It's kind of counterintuitive to the message that the alphabet mafia likes to perpetuate. The message about love and acceptance. One of the most important things you can do is accept yourself. But I see the opposite happening. And one thing that I have heard some trans women say, now Briana doesn't say this in the interview, but I have heard other trans women say this on YouTube. And what they say is that they transitioned because they are not attracted to gay men. So these are people who prior to transition were gay men, but they were interested in heterosexual men because they find heterosexual men more masculine and more desirable. And so their goal is to be able to successfully pass as women and date heterosexual men rather than having to be a gay man and date other gay men. That specific motivation is rooted in homophobia. It's a form of internalized homophobia, and I don't think it gets discussed enough how there are people who are transitioning because they think it's better to pass as a heterosexual person than to live as a gay person.
You now go to your family, you write this letter, you say, I want to transition, and you immediately go to a gender clinic.
Yes.
What is a gender clinic? What happens when you walk through the door?
A gender clinic is basically full of doctors, nurses, various specialists like psychiatrists, social workers, endocrinologists, surgeons, all within a network or a hospital, but they are all focused on gender-related care, or gender-affirming care is typically what they refer to it as now.
And just to remind the audience, how old are you at this time?
14? Yeah, about 14. Mm-hmm.
Okay, so you get there on the first day, and you must be excited.
Yeah, I thought that this was like finally the first time I would feel like a normal person.
And who's the first person that you speak to when you get there?
Yeah. I believe it was a clinical social worker. I do not remember her name because that was sort of like the preliminary before any prescriptions or any sort of like diagnosis is you had to sit with a social worker. And it was very brief. It was about 30 minutes. It wasn't really that comprehensive. It kind of just asked me, oh, like, how do you identify? What makes you feel like this? Is this something you think you'd really want to do? But yeah, like I said, about only half an hour. Then I had a prescription for hormones. And then I also received,
Well, wait a minute. Oh, you're telling me 30 minutes? Somebody sits down with you and
30 minutes. And then you meet with like the doctor who becomes your primary care. And so I had that assigned to me. And she's the one that then writes the prescription.
that easy.
Yeah.
You get a prescription. What did you get a prescription for?
Yeah. So I received hormones, the estrogen. I received a testosterone blocker. And then only twice did I have the blocker injection because I was 14 at the time. So puberty was going to start. And the injection, I'm not sure if a lot of people are familiar with, it actually lasts an extended amount of time.
Okay.
So it's only, I believe, once every 3 to 4 months is typically, it's varying times that it's administered. But mine was I had it twice over that. I had once every 3 months, and then I began hormone replacement.
So you didn't have to speak to therapists. You didn't have to
just
come
once.
in every week. Let's unpack your childhood.
Nope.
It was social worker, 30 minutes, here's
One
a
time.
doctor.
Yeah.
And now you can start blocking your puberty.
Yes, you just have to do it one time. It's kind of just like a preliminary, and then
It's like they're checking a box.
Yep.
Like we talked and here you are.
I have spoken about this many times on my channel, and I'm going to continue to bring it up because I think it's important for people to know this, that there is no standardized way to test for gender dysphoria. Doctors have these statistical manuals that are very sophisticated, and they can test for things like bipolar disorder, post-traumatic stress disorder, histrionic personality disorder. They have these assessments that are so sophisticated that they can detect when someone is malingering, so when they are being dishonest about the condition that they claim to have for various reasons. They have very sophisticated ways to test people for these different health conditions, but they do not have a standardized assessment to test someone for gender dysphoria. Gender dysphoria is basically the one condition where you diagnose yourself, the doctor affirms you, and then writes you a prescription for medication. And these doctors are writing prescriptions for puberty blockers for children. And this is the same drug that is also given to sex offenders to chemically castrate them. It is so important for people to know that many of these doctors are ethically compromised, and I have spoken about this on my channel before in another video, and I'm going to bring it up again here because it is very important for people to know this. Many of us are familiar with the ESG score, the scoring system created by BlackRock, where companies are rated on how woke they are. Of course, that is an oversimplification, but essentially that's what it is. Companies get a better score by doing things that are environmentally or socially responsible. This is why you see companies like Hershey's put a trans woman on the chocolate bar to celebrate things like International Women's Day. This is why you see companies like Bud Light hire people like Dylan Mulvaney to do partnerships. These businesses are looking to improve their ESG score so that they are deemed investable. There is an identical scoring system in healthcare, and it is being funded by Pfizer and Pharma. The scorecard is called the Healthcare Equality Index, or HEI, and healthcare systems earn points for pushing the woke agenda. So that means doing things like wearing a trans pin, putting pronouns on the door of a hospital patient, regardless of whether or not they are trans. It also means affirming children and giving them puberty blockers, no questions asked, because if the healthcare practitioner questions a child who says they are experiencing gender dysphoria, the mere act of questioning the child will be deemed as discrimination, and the hospital could lose points. And if a hospital or clinic has a low HEI score, it opens them up to discrimination lawsuits. So these healthcare professionals are being forced to push this agenda, and it's all being funded by Pfizer and Pharma, two companies who stand to gain a lot financially from the trans movement. And I just think it's so important that people know that. I read a great article from a former nurse who quit working in healthcare and became a whistleblower, and I will link the article in the description box down below so that you can learn more about the HEI scorecard. Knowledge is power, and hopefully the more people are aware of this, the more motivated people will be to push back against this.
You're starting at this new school, and people understand that you are a trans student, so that's known. Were you bullied at all?
Yes.
You were.
I was completely alone at school for most of the time. I remember people asking me questions about my genitals like the first day, and that was a big debate within the school. It was a big conversation. I pretty much didn't speak to anybody for like the first 3 years.
So still quite lonely.
Yeah.
Yeah.
I thought that I would feel brand new, and my mental health did not get any better.
So that was kind of the promise. Once you go down this path, everything's going to get better. It wasn't so much because you were still being bullied.
Yeah.
One way or the other.
Like I thought that this was just going to make me into a biological female, and I was going to experience what all of my friends were, but there was a lot of things I was completely blind to.
Right.
And that was one of them.
There are two things that Briana said that really stood out to me. And the first was that transitioning didn't make life any better. Oftentimes, parents are told that they need to affirm their children, otherwise the child may take their own life. And some parents will go along with the transition because they think they are doing what's best for their child. But the most realistic outcome is that the child will likely face more bullying and isolation at school rather than less. And on top of that, the medical intervention will now prevent the child from being able to fully go through puberty, mature into an adult, and realize that they are simply a gay adult that doesn't require any medical intervention. The second thing that Briana said that stood out to me was the belief that gender transition treatment could turn him into a female. I've seen a couple of people say this. They believe that surgery could make them a female, and this really speaks to the delusion that is being pushed by the gender ideologues. It is impossible to change your gender. Only your gender presentation can be changed. You can pass as a woman, but that doesn't make you a woman. You can pass as a man, but that doesn't make you a man. In the interview, Briana mentions not fully being one of the girls because Briana was unable to experience all of the same things as the other girls. Briana mentioned that being on puberty blockers and hormone replacement therapy diminished Briana's interest in boys and removed sexual feelings. You know, that's something that most teenagers will go through when going through puberty, and Briana was unable to experience that. So Briana mentioned still having low self-esteem and low self-worth, and what Briana thought at the time would be a way to fix that would be to have bottom surgery.
Okay, so you are seeing Dr. Joshua Roth based out of Indianapolis?
Yes.
And how does your consultation go?
They handed me a blue piece of paper, and it was like taking an order. Like, oh, how do you want us to do the surgery? Here's 3 different ways we can do it. So the most common and the most long practiced is referred to as penile inversion.
Okay.
That is when the inside of the organ is composed of the penile tissue, and it is exactly how it's stated. It's inverted almost internally. That's been the longest form of the surgery. There is another one that is also practiced. It's called the sigmoid colon graft. That's where they take a graft of the sigmoid portion of your colon, and they use that for the internal organ. There's a lot of complications with that. You typically have a colostomy bag. There's also smell associated with that, risk of infection. It is possible, although a lot of surgeons don't prefer it. And then what I had was something I had never heard of until I went to Dr. Roth, and it was called the peritoneal pull-through vaginoplasty.
Okay.
So they went in laparoscopically into my stomach, took out the inner lining of the skin, and it's called the peritoneum, and they used that graft to create the internal organ. I had severe pain all over my body. I actually had an epidural in because of the pain. I could not use the restroom, and just a few days later, I had blood clots in my legs. I had a DVT.
It's a DVT?
It's a deep vein thrombosis. It's a large clot that was in my leg, and they only discovered it because I had a fever. So from there, I had to be on blood thinners for 3 months, and I had to do injections every day. I was in the hospital for about maybe 2 weeks. And during my time there, I remember there was an intense fascination with what was being done to me.
Bottom surgery is still a relatively new procedure that is increasing in popularity. It is estimated that 9,000 people undergo gender reassignment surgery every year in the US, and as these procedures grow in popularity, it's becoming increasingly taboo to discuss the possible downsides that come with gender-affirming care. According to research done by PubMed, 55% of trans women who have bottom surgery are in so much pain they need medical care years later and up to a third struggle to use the toilet or have sex. When doing research for one of my previous videos, I learned of class action lawsuits that have been filed and settled in the last 6 years against the company that makes the Androderm testosterone patches and Androgel, which is testosterone in gel form. The testosterone patches and gel are used to treat medical conditions in men, but they are also prescribed to trans men as a part of gender-affirming care. The lawsuits were filed because the testosterone treatment unnecessarily increased the risks of strokes, heart attack, and death.
I would try and call the doctor. I would say, this feels wrong. Like, there's just no way that this is what it's supposed to be like. It looked horrific on the outside. Like, I mean, it didn't, and it still doesn't really look like any kind of genital. It looks like something in between. And even when we went in for checkups, he just kept saying things were fine. He was like, oh, things are fine. My mom would be there. He was like, oh, this is fine. And I would ask questions. I'm like, what about this pain? Like, I'm still bleeding. Like, I'm still having like discharge coming out. Like, I'm still in so much pain. Like, even 2 months later, I would walk and it would feel like there was a brick right here. Like, it was just nonstop pain. And he said, oh, it's fine. It'll go away. Just a few months later, I got to a point where I called him and I said, this pain is not going away. It's getting worse by the day. There was no infection. What was happening was I had scar tissue all internally from the new organ, and it was collapsing and causing my pelvic floor trauma. And he told me, there's no recovering this.
Well, I just want to say that he sounds like an absolute monster. And in my view, he should be put into prison for what he did to you. And because he's never going to have the spine to say it, I want you to know that I am so sorry for what happened to you. That is horrific. This should happen to no one, especially when you're entrusting your life to people that are supposed to be professionals.
Yeah.
Gawking at you as you come out of surgery, bringing people to come look at his work, and then being a coward and hiding from the consequences of what he did. In my view, he should be in prison for what he did to you. It is the worst kind of assault, in my view.
And I was only 20.
You were 20, just beginning your life, really believing that this was going to make your life better, and you cannot even contact him.
It's important that more people, like Briana, share their stories, especially because Briana is not a detransitioner. Many trans activists are very dismissive of detransitioners because they view them as a threat to their ideology. But these are people who are just simply warning others so that they don't have the same negative outcomes that they experienced. I really encourage you to watch the entire video. Like I mentioned, I will have the whole interview linked in the description box down below. If you liked this video, please don't forget to hit the like button. If you learned anything that you want to share with other people, please don't forget to share this video. Doing things like sharing, liking, subscribing are all things that really help my channel out, and they are free. If you would like to support my channel monetarily, I do have a Patreon account. I will have a link to that in the description box down below as well. I will also have a link to my social media. You can find me at NissCee.Social on Instagram. Thank you guys for watching. I will see you in the next one. Take care. Bye.